going to be talking to you about fluency disorders. Here, a basic definition of stuttering, which usually begins in early childhood and is the most common disorder of fluency. Stuttering is defined as a disruption in the fluency of speech, characterized by involuntary, audible, or silent repetitions, or prolongations of sounds, syllables, and words. Typically, stuttering begins in childhood, but in more rare cases can be seen manifesting starting in adults who may have suffered a traumatic brain injury or acquired neurological deficit. But again, most commonly begins in early childhood when children are starting to develop language skills. Sometimes, in more rare cases, it can be associated with emotional problems and it can be components or byproducts of the problem. But again, just to emphasize here that stuttering usually begins in early childhood and is the most common disorder of fluency. Stuttering also can be an acquired organic or neurological stuttering basis, which can, like I mentioned earlier, occur as a result of head trauma, traumatic brain injury, and the individual did not have a past history of stuttering disorder. Another more rare case, again, is psychogenic stuttering, again, as a result of some type of emotional or psychological trauma. Cluttering is another type of fluency disorder, which can be seen as more of a combination of motor programming difficulties with speech production in combination with fluency disorder. So it's a disorder of both speech and language processing, characterized by rapid, dysrhythmic, sporadic, unorganized, and frequently unintelligible speech. Cluttering is again less common fluency disorder than traditional stuttering disorders. It can also begin in childhood. Because there also is a language component to this disorder, this is also associated with academic struggles. Some basic statistics here about fluency disorders. There is a greater number of males who stutter than females, and twins have a higher prevalence of stuttering, indicating that there is oftentimes a genetic basis for the prevalence of stuttering in families and then obviously in siblings. Stuttering, I mentioned, begins when a child starts to string words together, and when a child starts to develop expressive vocabulary and then starts to combine those words together and speak in basic sentences. We know that stuttering increases in different speaking situations, and interestingly, more stuttering is found in children who are bilingual. Obviously, how should someone react when you're talking to someone who stutters? And obviously, you would engage in a courteous conversation as you would with any other person you are communicating with. To go through some of the theories of causation of stuttering, your textbook discusses some of these theories, and some of the theories have some more weight than others. So the first one is cerebral dominance theory, and that suggests that stuttering occurs because neither side of the brain is dominant in controlling the motor movements of speech. Biochemical physiological theories suggest that stuttering is more of a seizure-like disorder, okay, triggered by emotional stress. And then there is the genetic theory, which points to the concentration of stuttering in families. And this genetic theory has some weight in more recent research. I did post a research article in the learning module for this topic that discusses a study related to looking at stuttering in families. The neuropsycholinguistic theory suggests that here there's a dysfunction between the communication of the linguistic and paralinguistic systems cognitively that we use to be able to have fluid and fluent speech. And if there's a dysfunction between these two systems and then combined with the pressure to speak, that can cause stuttering behavior. It also points to that stuttering is caused by a deficit in the monitoring of speech production. So this theory has a little bit more weight as some of the research continues to indicate today. Here, the semanogenic theory. This was a theory that was held here. You can see the dates 1940 through 1970. And this theory really thought that stuttering was caused by the environment, specifically parental anxieties, pressures, criticisms, and corrections. Okay. It's also referred to as the developmental theory and anticipatory struggle theory. So we know this doesn't exactly cause stuttering. However, as we talk further on in the slides, definitely parental interaction and how a parent reacts to stuttering can definitely affect the severity and possible continuation of stuttering. Okay, so some of these other theories on this slide here refer to more of a psychological base for stuttering. Again, not each one of these theories that we're talking about here, there's not a single one that exactly causes the stuttering, but each theory has a little bit of weight in that we know that there is some element of truth that is a part of the stuttering disorder or could contribute to it. So we know that individuals who have a stuttering disorder may have negative feelings about their communication skills and the fact that they do stutter. Okay. Here, conditioning theories is more of a behavioral approach and suggests that here the breakdown in speech fluency then is tagged with an individual's anxiety about talking. Okay? And that stuttering is a symptom of the conditioned fears now every time a person tries to talk that they're going to be afraid of stuttering. So we know, again, like I said, that there is some anxiety that individuals may have about talking and being afraid that they're going to stutter, but that's not exactly the ultimate cause of why they stutter. So here, focus on here the contemporary research, so more current research in stuttering. We're really looking at the neural correlates or neurological basis at the cortical level of what causes stuttering. And looking at adults who continue to stutter through adulthood, and looking at here differences in brain structure and function for speech and language purposes among those adults who continue to have a stuttering disorder. disfluency can occur in children who are developing language, and this occurs between the ages of 2 and 3 years old. So normal disfluency can be characterized here by an increase in effortless repetition of words and syllables. So this is referred to as developmental disfluency. This period can vary in length from several weeks to several months. However, the key characteristic here is that this normal disfluency pattern disappears, so it gradually goes away. And the most important thing you need to remember is that the key is effortless repetition of whole words. Okay, it could be a syllable here and there, but the majority of the disfluencies are repetitions of whole words, and they are effortless. Okay, so those are the key characteristics there. So here, to talk about the different phases of stuttering according to Bloodstein's outlined in your textbook. And phase 1 is considered to be the preliminary phase of someone developing a stuttering disorder, and it can be episodic, so coming and going, and consists of repetitions of words or syllables at the beginning of an utterance. Okay, so this could be possibly entering into the very early stages of a stuttering disorder. Phase 2, stuttering is more chronic now, so it's occurring more often, and the child is aware of the disfluency and their difficulty in speaking. Phase 3, stuttering here now continues to vary, though, with specific situations. So it gets worse in certain situations, and the child has fears about stuttering and may avoid speaking and speaking using certain words. So stuttering in phase 3 often occurs when there's more anxiety or stress around a speaking situation, when a child is trying to retell events, really communicating in more novel kinds of communication situations where their demand for word recall is very high. So they're retelling a story, they're retelling information to someone in conversation, and they have to really pull all of their language resources and vocabulary to be able to relay the information on their own. And that's when you're going to see more of stuttering events in those situations. Phase 4, stuttering is now anticipated, and the individual has fears of words and sounds, and they're aware of the different situations that may cause more stuttering, and they try to avoid speaking situations. So when someone does have a stuttering disorder, they also may demonstrate, we say, accessory or secondary strategies. And these behaviors have been learned as a result of trying to avoid stuttering and or trying to get the words out. So here, some of the behaviors that are mentioned according to Van Riper in your textbook: postponement is a temporary delay. So a delay in speaking, okay, which takes the form, it could be a vocal or non-vocal behavior. Starters is use of a body movement or stereotyped utterance, okay, to get a running start. So that's what I mentioned before, to actually try and get your word out, to facilitate production of a word that's anticipated to be difficult. So use of a body movement could be I worked with an individual who often used their hand to slap their leg repeatedly when they were stuttering to try and get the word out. Some other types of body movements could be some type of body flinching or facial movements that seem abnormal. Substitutions is a use of another word in place of the word that the individual feels that they're going to be disfluent. So they're switching words, okay, when they feel like they're going to stutter or not be able to get a particular word out. Circumlocution is use of additional words. So adding in words that they know they can get out. So their speech output seems to be kind of talking around a particular word that the individual feels that they can't actually say fluently.